Alright, hello Miss Mariel. I'm Elizabeth Baker. I'm going to be your nurse today, and I'm just going to do a general assessment on you. And I'm going to have you remember my name because I'm going to ask you later on to repeat it. So can you do that for me?
Mm-hmm.
Elizabeth Baker, okay. Alright, I'm just going to wash my hands before we get started. It's fun. Okay, let's start this assessment. Okay, you seem to be healthy, vigorous. You are a Caucasian female. And can you tell me your weight, please?
113 pounds.
Okay, and how about your height?
5'2".
5'2", okay. Your BMI is 20, so you're within normal range, or whatever, so good. Your dress looks appropriate, and your grooming and hygiene is good. Your mental status and general demeanor is cooperative, and your affect is animated, and from what we've briefly spoken, your thought pattern is logical, as well as your speech is articulate. And you seem alert. And to check your orientation, I'm going to ask you a few questions. Can you tell me your full name?
Mariel Baker.
Okay, cool. Can you tell me where you are right now?
I'm in the basement.
Okay, good. What day of the week is it?
Tuesday.
Okay, good. And if you were in the ER or you had some sort of trauma to your head, I would ask you what situation led to you being here, but you're not. So you're good. You're alert and oriented ×3. So that's good. And if I told you that an apple a day keeps the doctor away, how would you explain that to me?
That the more you go to the doctor, the healthier you're going to be.
Yeah, pretty much. Okay. If it was raining outside, how would you prepare for that?
I would bring an umbrella or wear a rain jacket.
Okay, cool. Alright, those were appropriate answers and logical and appropriate. And to check your vital signs now, can you tell me, do you have any pain right now? Anyone?
I guess my back kind of hurts.
And on a scale of 1 to 10, 10 being the most serious, how would you rate that pain?
2.
2? Okay. Good to know. Thank you. And then, yes, to check your other vital signs, I'm going to take your temperature. Dr. Harris, I don't have a thermometer, but I will do this. 98.1 within normal ranges. Okay, good. And then I'm going to check your pulse. Okay, your pulse was 72, and your respiratory was 18. So those were within normal limits, that's good. And then I'll take your blood pressure real quick. Okay, so technically your feet shouldn't be dangling, so I'm going to have you sit in this chair. And is it alright if I use this one?
Mm-hmm.
Okay, awesome. Very strong. So I got 100 over 668. Does that seem about normal range to you? Yeah. Okay, you can sit back up on the table. Okay, so those were your vital signs. I'm just going to look at your head and neck now. So after checking, your head seems to be normal cephalic, not too small, not too large, and there doesn't seem to be any malformations or lesions or anything, and your head and facial structures are symmetrical, so that's good. And I'm just going to check your hair. The color is brown, blonde, and red. Perfect. And I'm just going to feel the structure and the texture. Okay, it is appropriate, and there's nothing, not brittle, but it's nice and soft, and there were no lacerations or lumps or anything. And to check your eyes, do you wear any glasses?
When I drive, yeah, to see from far away.
Okay, cool. Good to know. Then I'm just going to check your alignment of your eyes. Okay, prominence is appropriate. There's no ptosis or endohypothalamus or anything like that. Okay, and then I'm going to check perla, which is like pupils being equally round and reactive to light. So I'm going to have you look, alright, I'm going to have you look straight at my nose, and I'm going to shine a light into, good. Okay, perfect. Perla is appropriate. And now to check accommodation, I'm going to have you look straight back at the window back there. And then when I tell you to, I'm going to have you look at the pen. Maybe look a little lower. Okay.
Just looking at you.
Wait, don't look at the pen yet. Look straight, and then, okay, look at the pen now. Okay. Appropriate. Oh, wait, one more thing. And then I'm going to have you follow the pen to different fields, so. Good. Good. Okay, perfect. Those were appropriate facial features. Your eyes look good. And then, yes, I'm going to check your ears now. Okay, both ears look symmetrical, and there doesn't appear to be any lesions or lumps on them. I'm just going to look inside. It's just an appropriate amount of earwax, but nothing too strong. Your hearing seems intact because you were answering my questions earlier. Yeah, there didn't seem to be any redness or signs of inflammation or anything, so that's good. And then to check your nose, have you had any drainage or excess mucus production lately?
Yeah, sometimes in the morning I just cough a lot. Mucus.
Okay, but nothing from your nose. Okay, I'm just gonna check for septal deviation in your nose. No, it looks appropriate, so that's good. And then have you had any breathing or smelling difficulty? No? Okay, perfect. Okay, that can end part 1. Okay, assessment part 2. Okay, so I'm gonna check out your throat now. And could you open your mouth really wide for me? Okay, I'm just gonna check the back. Okay. Awesome. Your throat looks good. Oral pharynx was pink, moist, and intact, and there didn't seem to be any lesions. So that was good. Your teeth look good. You obviously don't have any dentures, so that's good. And you weren't missing any teeth, so. Okay, I'm not gonna check your gag reflex. But, okay, can you swallow for me? Okay, good. Did that hurt or anything? Good, okay. Cool. And then, alright, tracheal alignment. I'm just going to take my 2 fingers and palpate all the way down. Okay, cool. All the way down to the sternal notch. It was symmetrical and palpable all the way down. So that's good. And, okay, cool. I'm just going to check your lymph nodes now. Based on inspection, there's no signs of lymphadenopathy. I cannot say that word. And then I'm just going to do a rotating palpation throughout all of them. So preauriculars look good. Postauriculars. Occipital. tonsillar, submandibular, segmental, superficial cervical, posterior cervical, deep cervical, and supraclavicular. Okay, how did that feel? Was there any was there any tenderness or anything?
Just a little here.
Down there. Okay, I might have been massaging you too roughly. But yeah, no lymph nodes were were non-palpable, so that was good. And okay, I'm gonna measure feel your carotid pulses on both sides.
Karate pulses.
No. Carotid.
Oh.
Okay, your right one feels good. Okay, and your left carotid pulse is symmetrical with your right carotid pulse. I give it a 3+, which is good. It means it's strong. And I'm going to listen for Burmese. So I'm just gonna. Okay, I'm gonna have you take a deep breath and then exhale and then hold your breath for me, but turn your head to the side, okay? So give me a thumbs up when you're holding your breath. Okay, perfect, thank you. Okay, no sign of any breeze. Yeah, there's no turbulence on the left or the right side, so that is good. Okay, moving on to the skin portion of the assessment. Okay, your color looks appropriate, and temperature is warm. Flesh tone, moisture, it's not too dry, or it's not wet. Texture was also smooth, and then I'm gonna check the skin turgor real quick. Okay, it pinched right back, which is good. Skin turgor is appropriate, and there doesn't appear to be on inspection any lesions or anything. That's good. Okay, I am going to check out your heart now. So I'm gonna have you lie down here, put your here, so you're not. Put your head on this pillow. Yes, I'll have you lie down. You're doing great. Sorry, it's uncomfortable. Okay, now I'm gonna get eye level down to check if there's any signs of pulsations or anything. So upon eye level, there doesn't seem to be any heaves or lifts, so that's a negative sign for cardiomegaly, which is good. And now I'm going to palpate for any pulsations. So I'm going to start at the angle of Louis, which is right here, and then go to the second intercostal space, which is the aortic. And I don't feel it's negative for pulsations and negative for thrills. And then back to the angle of Louis to check out the second intercostal on the left side, which is Erb's point, and it's negative for pulsations as well as for thrills. We go down to the third intercostal, negative for pulsations and thrills, down to the fourth intercostal, negative for pulsations and for thrills, and then the fifth intercostal, which is also a tricuspid, is negative for pulsations and for thrills. Take a half step, and then the mitral or the PMI, and I do feel pulsations, which is what I'm supposed to feel, so that's good. And it's the same rate as it's consistent with the vital sign pulses. It's intense and strong, which is good. Okay, now I'm just going to auscultate your heart, so I'm just going to give it a listen to. Yeah, just sit back, relax, auscultate. Okay,
What does that mean?
listen to. Half step, and then the mitral point. Okay, perfect. Okay, I didn't hear any extra heart sounds, but if I did, I would listen to it a second time with the bell, which you use to hear the low sounds in the heart. S1 and S2 sounds were appropriate. S2 was heard loudest at the top. S1 was heard loudest at the bottom. Yeah, the rate was also consistent with the vital signs. Strength was strong and rate was appropriate. Okay. We can stop there. Okay, assessment video number 3. Alright, I'm going to check out your lungs and thorax now. So could you sit up straight for me? Okay, there's no barrel chesting. And I'm going to palpate your shoulders and down. Could you give me a nice big shrug? Like, could you hold it out? Okay, perfect. Thank you. Yes, and then I can feel the clavicle. Which feels appropriate, good. All that was symmetrical and good on the anterior structure. And then, okay, I'm going to check for respiratory excursion. So I'm going to do that thing in practice. Alright, I'm going to put my hands here and then have you look to the side and take a deep breath for me. Okay, perfect. These deep symmetrical lungs and expansion and there are no lesions. Okay, and then I'm gonna auscultate your lungs now, first starting with the anterior side. So I'm gonna have you I'm gonna have you breathe deeply, but no, I'll do that after. Thank you for being prepared. I'm gonna have you breathe deeply, but no quicker than usual. And I'll have you look to the side, so you're not breathing on me. Okay, whenever you're ready. Good. 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 Okay, last one. Okay, awesome. There was no adventitious breath sounds. It was consistent, the rate was consistent with your vital signs. Rhythm was regular, depth was deep, but that's because I asked you to breathe deeply. Effort was deep, yes. Effort was non-labored. And yeah, no adventitious breath sounds. It was clear, even, and easy to hear, and there was no signs of crackles or wheezes or anything. Okay, I'm gonna check out the posterior side. If you could turn around so I can see your back. Perfect. And could you give yourself a nice big hug? Okay, and then again, breathe deeply but no quicker than normal. Okay, whenever you're ready. Good. Perfect. Good. 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 Must have. Okay, good. Rate was consistent with your vitals. Sorry. Rhythm was regular. Depth was deep because I asked you to. Effort was non-labored. No adventitious breath sounds as well. No crackles, wheezes. Sounded good to me. Okay, cool. And now for abdomen assessment, I'll have you lie back down again. Okay, and now I'm gonna get. Just move your hands to the side. Okay, I'm gonna check. Get eye level to check your abdomen for any pulsations or anything. And from what I can see, it appears to be appropriate and good. No lesions appear to be evident. Yeah, no distension present. And so I am going to pick one quadrant of your abdomen and listen to it for 1 minute. You can direct me where here. I'll start here, and then I'm just gonna put my hand down, okay, and listen to it for 1 minute. Awesome. Okay, so I got 14, and that's within normal limits or range. Anything between 5 and 34 is good. So it was normoactive. Are you bored? And that was a normoactive bowel sounds, so that was good. So I'm just going to percuss with my finger.
You know what?
Percuss your abdomen one more time, and I'm just going to tap on it to check for any dullness or anything. Did that feel tender or anything? How did that feel? It was good. Good answer. Okay, perfect. No dullness was heard. And then I am going to. Okay, I'm also going to. Okay. I'm going to check for any tenderness. You're doing great. Okay, was any of that tender?
No.
Okay, so I was checking the light and deeply. Yeah, so it was negative for palpations, and there was no abdominal distension. Okay, so you're good, you can sit up. Okay, so to assess your musculoskeletal, I'm going to ask you, do you have any joint pain or stiffness or anything?
My knees tend to crack easily.
Okay. Okay. I'll alert the doctor about that. See what you can do. You don't have any deformities visible, so that's negative for that. Do you have any moving difficulties with your lower,
No.
sorry, your upper extremities?
No.
Okay. Besides your knees cracking, are there any other crunching or cracking going on anywhere else? No.
No.
Okay,
Not really.
Okay. Yeah, I'm gonna look at your upper and lower extremities. They seem to be appropriate and symmetrical, which is good. And then again, I will check. Okay. Skin feels, your temperature is warm and appropriate. And its skin's appropriate color as to the rest of the body. There's no lesions that I can see. now I'm going to feel both your radial pulses real quickly again. Okay, so they're strong, I give it a 3+, and they're consistent with one another, strong and present. And then to feel your, is it okay if I take your socks off? I'm doing it without your permission. I'm just gonna check your pedal pulses. So, the posterior tibial pulse. Okay, cool. They're good. They match one another. And this is the dorsal pedis pulse. Good. Okay, awesome. Those feel good. They are strong, present pulses, and all that is symmetrical with one another. Okay, now let's check capillary reflow of your toes. So I'm just gonna put some on kind of cold. Okay, but they're brisk. I'm just pinching them, and the color is coming right back to them immediately, so that's appropriate. The color comes back within 2 seconds of each other. Yes, here, go for your socks. Thanks, Prince Charming. Didn't want that joke. Okay. Okay, and then for capillary reflow up here, I'm just going to check your fingers, do the same thing. Okay, good. Good. So I'm going to do your thumb, middle finger, and the pinky. Okay, good. So we would call that brisk because it returns right back to color. Less than 2 seconds. So there's no need to check for hitting edema because all of that looked good. Okay, now I'm going to cross my fingers and have you squeeze as hard as you can. Okay, good. Now can you push toward me? Okay, now hold. You know what I'm talking about. Good. And then up here, could you push back? Pull back. Okay, now could you push towards yourself?
Oh, it's you.
Oh, push towards me. Good. Okay, that was proper resistance range of motion or whatever. Okay, so I'm gonna check your reflexes really quickly. So, okay, I'm gonna put my hand right here. Okay, wait, could you flex your muscle? I'm gonna check this. And now, I'm gonna hit my thumb. Okay, that's pretty good. Okay, and then I'm gonna do the same thing on your side. Could you flex your muscle? Like, give me, like, yeah, like that. Now hold it straight. I'm gonna hit my thumb. Okay, good. So, reflexes are intact on the upper extremities. Okay, so I'm gonna check your knees up here. Okay, good. Okay, barely hit you. Okay, I'd give it a 3+.
Not on purpose.
It's kind of too reactive. So that's good. I'll give it a 2+, and then patellar, give it a 3+. So biceps and patellar reflexes are intact. And, okay, so coordination, I'm just going to have you stand up and walk to that wall over there. And then come back. Okay, perfect. Your posture is steady, your arms were swinging, there's no ataxia or imbalance that appear to be there. And do you have any tingling sensation or numbness anywhere? No. Perfect. And yes, going back, Ariel, BMI of 20, 113 pounds, weighs 5'2", vital signs. He's 5'2", height-wise. Vital signs were within normal limits. It was normal carded for her heart, eupenic for breathing, and normotensive for her blood pressure. And to conclude this assessment, can you tell me what my name is?
Elizabeth Baker.
Very good, you passed the test. Thank you so much, Miss Mariel.
Thank you.
Bye-bye.